All right. We have 7.
We do.
Are we live?
Yes, you're live.
Great.
And is Mr.
Good afternoon. Welcome to Health Coverage Insurance and Financial Services. We have a couple of confirmation hearings today, a presentation at 1:30 and some language review, but we'll start with introductions from the committee with Representative Mastracchio.
Good afternoon. I'm Anne Marie Mastracchio. I represent House District 142, which is part of the city of Sanford in the village of Springvale.
Good afternoon, everybody. I'm Representative Paul Flynn. I represent House District 63, which is Winslow, Albion, Freedom, and Unity Plantation.
Good afternoon. I'm Rolf Olson, District 86, which is Raymond, Casco, Fry Island, and a bit of Poland.
Good afternoon. My name is Bob Foley. I represent House District 145, which is most of the town of Wells.
Good afternoon. I'm Sally Clucci. I represent House District 52, which includes the communities of Bowdoin, Bowdenham, and Richmond.
And I am Senator Donna Bailey. I represent Senate District 31, which is Buxton, Old Orchard Beach, and Saco, and I serve as the Senate co-chair.
And good afternoon. My name is Christy Matheson. I represent Kittery District 151, and I serve as the House co-chair. And we are starting with Ms. Wake's confirmation unless Mr. Colpitts is here. Okay, great. So this is a public hearing of the Joint Standing Committee on Health Coverage Insurance and Financial Services for the purpose of considering the nomination by the governor of Rebecca Wake of Augusta for reappointment of the Maine Retirement Savings Board. Under the law and joint rules of the legislature, this committee is required to hold this public hearing and to recommend confirmation or denial of the nominee by majority vote of the committee members present and voting. As chairs of the committee, we will then send written notice to the committee's recommendations to the President of the Senate. The committee will hear testimony from and have an opportunity to question the governor or her representative, the nominee, and any other persons present who wish to speak for or against the nominations. Persons testifying at the public hearing today are advised that the hearing is live streamed and may be seen and heard by persons watching online, and that a recording of the meeting will be archived. Do I have a motion pursuant to Title III, Section 157 of the Maine statutes, which requires that there be an affirmative motion to recommend confirmation of the nominee? I recognize Senator Bailey for the purpose of making such motion.
Thank you, Madam Chair. I move that the Joint Standing Committee on Health Coverage Insurance and Financial Services recommend confirmation of Rebecca M. Wake of Augusta for reappointment to the Maine Retirement Savings Board.
Thank you. A copy of the statutory requirements for this position is available at the rostrum. I recognize
Joe Bushy.
Joe Bushy for the purpose of making a statement concerning this nomination.
Thank you and good afternoon, Senator Bailey, Representative Matheson, and distinguished members of the Joint Standing Committee on Health Coverage, Insurance, and Financial Services. My name is Joe Bushy, and I'm the Director of Boards and Commissions for Governor Mills, and I'm happy to be here on behalf of the governor to speak in support of the nomination of Rebecca Wake of Augusta for reappointment to the Maine Retirement Savings Board. The board was established by LD 1622, an act to promote individual retirement savings through a public-private partnership, which was signed into law by the governor in June of 2021, and the original membership was seated in early 2022. The board has been charged with developing and maintaining the Maine Retirement Savings Program. It consists of 9 members, the state treasurer or their designee, and 8 members appointed by the governor. Rebecca Wake of Augusta has served as the representative of an association representing employees, including covered employees, or who has skill, knowledge, and experience relating to the interests of employees in retirement saving since the board was seated in 2022. She is currently the executive director of the Maine Public Employee Retirement System and previously served as the president of the University of Maine at Augusta, vice president of finance and administration for the University of Maine system, and as Commissioner of the Department of Administrative and Financial Services during the Baldacci administration. Ms. White's vast knowledge and experience have made her an invaluable addition to the Maine Retirement Savings Board. On behalf of the governor, I would urge you to support her nomination. And if you have any questions, I'd be happy to attempt to answer them.
Thank you, Mr. Bushy. Is there any committee member that has questions for Mr. Bushy? Seeing none, thank you for your
Thank you.
testimony. I now will recognize Rebecca White, sorry if I enunciated that incorrectly, for the purpose of making a statement concerning this nomination.
So my constitutional law professor used to call me Miss Wiki. So I'm used to that.
Sorry about that.
Senator Bailey, Representative Matheson, and members of the committee. And my name is Rebecca White, and it's a pleasure to be here today to discuss my nomination for the Maine Retirement Savings Board. I am completing my first term on the board, which was an initial 4-year term that began on March 9th, 2022. As Joe indicated, I have spent my career in public service, currently serving as the Chief Executive Officer of Maine PERS. Prior to that, I worked for 13 years at the University of Maine System, beginning my tenure as Vice Chancellor for Finance and Administration and ending as President of the University of Maine at Augusta, and also previously served in state government as a Commissioner of DAFs and the Chief Deputy Secretary of State. I began my service on the Maine Retirement Savings Board, working with the State Treasurer's Office and other members of the board to establish the new agency. I served as Vice Chair of the board and on the hiring committee that selected the current Executive Director. I also served on the working group, which was established to explore potential partnerships with other states, which ultimately ended in a recommendation to join the Partnership for a Dignified Retirement led by the state of Colorado. I am proud to have been part of this important work to expand access to retirement security for people of this state through access to an easy, low-cost retirement savings program, and I would like to continue to support this work. I thank you for your consideration of my candidacy, and I'm happy to answer any questions you might have.
Thank you, Ms. White. Are there any questions from committee members? Seeing none, thank you for your testimony. I'd like to take comments from any persons attending the hearing who wish to speak for or against this nomination. Anyone who has a written statement but who does not wish to speak should have submitted the statement with the committee clerk prior to today's hearing. All such statements shall contain the name and residence of the person who prepared the statement. A copy of each written statement presented to the committee at this hearing will be made available to the nominee prior to the committee's vote, and the nominee will have the opportunity to respond to the written comments. Those who wish to speak should observe the following. Please sign in on the testimony sheet on the podium. Please speak from the rostrum and state your name and place of residence prior to presenting your testimony. Persons participating electronically will be called upon by the chair, at which time they will be prompted to panelist status in Zoom and can be seen and heard. Is it really warm in here?
Yes.
Ken, do you mind? Thank you. Or is it just me? Only comments concerning the suitability of this particular nominee for this particular position will be considered in order. All other comments will be considered out of order, including my comment that I just made. Please remain at the podium after you complete your statement so that the members of the committee may have an opportunity to ask questions. First, is there anyone present who wishes to speak in favor of the nomination? We have no one online, right, Edna? Okay. Is there anyone present who wishes to speak against the nomination? Is there anyone who wishes to speak on the nomination in any capacity? All public comments having been taken, the committee will now proceed as follows. Review any additional written comments on the nomination that have been received by the committee. Vote on the nomination and notify the President of the Senate pursuant to Title III MRSA Section 157 and the joint rules. The vote must be taken within 35 days from the date of the governor's written notice. The hearing by the Joint Standing Committee on Health Coverage, Insurance, and Financial Services for Rebecca White of Augusta for reappointment of the Maine Retirement Savings Board is now closed. In accordance with the law, the committee may take the vote on this nomination no sooner than 15 minutes after the close of the public hearing unless all committee members who are present agree. At this time, I will inquire whether any person objects to proceeding to take the vote immediately. Seeing no objection, the pending question before the committee is that the Joint Standing Committee on Health Coverage, Insurance, and Financial Services recommend to the Senate of the 132nd Maine Legislature that the nomination of Rebecca White of Augusta for reappointment of the Maine Retirement Savings Board be confirmed. In accordance with 3 MRSA Chapter 6, Section 157, and with the joint rules of the 132nd Legislature, the votes will be taken by yeas and nays. A vote of yes will be in favor of recommending the confirmation. A vote of no will be against the motion of recommended confirmation. Is the committee ready for the question? Committee clerk, can you do the roll?
Thank you. Senator Bailey.
Yes.
Senator Bailey, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Boyer.
Yes.
Representative Boyer, yes. Representative Clucci.
Yes.
Representative Clucci, yes. Representative Flynn.
Mind.
Yes.
Representative Flynn, yes. Representative Foley.
Yes.
Representative Foley, yes. Representative Mastracchio.
Yes.
Representative Mastracchio, yes. Representative Olson.
Yes.
Representative Olson, yes. 8 members of the committee having voted in the affirmative and 0 in the negative.
8 members of the committee having voted in the affirmative and 0 in the negative. It is the vote of the Joint Standing Committee on Health Coverage, Insurance, and Financial Services that the nomination of Rebecca White of Augusta for reappointment of the Maine Retirement Savings Board be confirmed. Congratulations. Oh, great. Super.
I did get a message that Matt on.
He's on, yes. We'll wait for him to be seen.
Did you want to sign this?
Sure.
Just to make it legal.
Oh, welcome, welcome. Thank you for being here. It's nice to see you.
Likewise, yes. Thank you for having me.
Sure. This is a public hearing of the Joint Standing Committee on Health Coverage, Insurance, and Financial Services for the purposes of considering the nomination by the governor of Mr. Matthew Colpitts of Winthrop for reappointment of the Maine Retirement Savings Board. Under the law and joint rules of the legislature, this committee is required to hold this public hearing and to recommend confirmation or denial of the nominee by majority vote of the committee members present and voting. As chairs of the committee, we will then send written notice to the committee's recommendations to the President of the Senate. The committee will hear testimony for and have an opportunity to question the governor or her representative, the nominee, and any other persons present who wish to speak for or against the nomination. Persons testifying at the public hearing today are advised that the hearing is live streamed and may be seen and heard by persons watching online, and that a recording of the meeting will be archived. Pursuant to Title III, Section 157 of the Maine statute, which requires that there be an affirmative motion to recommend confirmation of the nominee, I recognize Senator Bailey for the purposes of making such a motion.
Thank you, Madam Chair. I move that the Joint Standing Committee on Health Coverage, Insurance, and Financial Services recommend confirmation of Mr. Matthew S. Colpitts of Winthrop for reappointment to the Maine Retirement Savings Board.
A copy of the statutory requirements for this position is available at the rostrum. I now recognize Mr. Bushy for the purposes of making a statement concerning this nomination.
Thank you once again, Senator Bailey, Representative Matheson, and distinguished members of the committee. Again, my name is Joe Bushy, and I'm the Director of Boards and Commissions for Governor Mills. Happy to be here again on behalf of the governor to speak in support of the nomination of Matthew Colpitts of Winthrop for reappointment to the Maine Retirement Savings Board. Mr. Colpitts is a graduate of the University of Maine with a degree in Business Administration and Management and a minor in Naval Science. After graduation in 2010, he served as a naval officer, first as a repair officer, then as a platoon commander, leading a 64-person team in executing daily security operations, and was responsible for 6 tactical boats and 18 vehicles. He then assumed the role of protocol officer at the Naval Postgraduate School, where he led day-to-day operations for the school's president. Since leaving the Navy, he has held several positions in the financial field, including 3.5 years as Deputy State Treasurer and his current role as Senior Vice President and Director of Government Banking at Northeast Bank, where he has been since 2021. Mr. Colpitts' vast experience has made him a valuable addition to the board, and on behalf of Governor Mills, I would urge you to support his nomination. If you have any questions, I'd be happy to try to answer them.
Thank you. Are there any questions from the committee members? Seeing none, thank you for your testimony.
Thank you.
I'd like to now recognize Mr. Colpitts for the purpose of making a statement concerning this nomination. Welcome.
Great, thank you. Thank you, Senator Bailey, Representative Matheson, members of the committee. My name is Matthew Colpitts from the town of Winthrop. I'm here today to discuss with you my nomination to the Maine Retirement Savings Board. And thank you in advance as well for being able to accommodate a virtual teleconference here. I'm currently sweltering in DC in a tiny box, and I appreciate the ability to do this. I've served on this board for the last 3 years, and I've seen the program grow from infancy to a fully functioning program, both as my time as Deputy State Treasurer, serving as a board member, and while serving as both the Director of Government Banking and Treasury Management Services at Northeast Bank. In all these roles, it's become very apparent of the importance of savings programs. Even though this program is fully functioning, there's still a whole lot of work to be done. It's important for this program to become fully self-sustainable over the next few years. It'll be crucial in ensuring that this is a mature, proper program. The program is currently optional for employees, at the same time, cost retirement service for employers to offer. There is no match for this program, but there are several stakeholders, including the employer, employee, whose experience in this program must be easy to use, choice-driven, and accessible. I have experience in both the public and private sector at creating new programs from completion. In addition to improving practices and gaining efficiencies in organizations, I wish to continue to serve our great state of Maine and believe my contribution to this board will help ensure the state creates a valuable service for all Mainers now and in the future. Thank you so much for your consideration, and I'm happy to answer your questions.
Thank you very much for your testimony. Are there any questions of the nominee from committee members? Seeing none, thank you very much for your time. And I'd like to take comments from persons attending the hearing who wish to speak for or against this nomination at this point. Anyone who has had written statement but who does not wish to speak should have submitted that statement to the committee clerk prior to today's hearing. All such statements shall contain the name and residence of the person who prepared the statement. A copy of each written statement presented to the committee at this hearing will be made available to the nominee prior to the committee's vote, and the nominee will have an opportunity to respond in written comment. Those who wish to speak should observe the following. Please sign on to the testimony sign-in sheet at the podium. Please speak from the rostrum and state your name and place of residence prior to presenting your testimony. Persons participating electronically will be called upon by the chair, at which time they'll be promoted to panelist status in Zoom and can be seen and heard. Only comments concerning the suitability of this particular nominee for this particular position will be considered in order. All other comments will be considered out of order. Please remain at the podium after you complete your statement so that members of the committee can ask questions if they have questions. At this time, if there are persons wishing to testify or present information in favor of the nomination, I invite you up to the podium. Is there anyone present who wishes to speak against the nomination? Is there anyone who wishes to speak in any capacity on the nomination? Seeing all public comments having taken, the committee will now proceed as follows. Review any additional written comments on the nomination that have been received by the committee. Vote on the nomination and notify the President of the Senate pursuant to Title III MRSA Section 157 and the joint rules. The vote must be taken within 35 days from the date of the governor's written notice. The hearing by the Joint Standing Committee on Health Coverage, Insurance, and Financial Services for Mr. Colpitts of Winthrop for reappointment of the Maine Retirement Savings Board is now closed. In accordance with the law, the committee may not take the vote on this nomination sooner than 15 minutes after the close of the public hearing unless all committee members who are present agree. At this time, I will inquire whether or not there's an objection to proceeding to take the vote immediately. Seeing no objection, the pending question before the committee is that the Joint Standing Committee on Health Coverage, Insurance, and Financial Services recommend to the Senate of the 132nd Maine Legislature that the nomination of Mr. Matthew Colpitts of Winthrop for reappointment of the Maine Retirement Savings Board be confirmed. In accordance with 3 MRSA Chapter 6, Section 157, and the joint rules of the 132nd Legislature, the vote will be taken by the yeas and nays. A vote of yes will be in favor of recommending the confirmation. A vote of no will be against the motion to recommend the confirmation. Is the committee ready for the vote? Go right ahead, Edna.
Thank you. Senator Bailey?
Yes.
Senator Bailey, yes. Representative Matheson?
Yes.
Representative Matheson, yes. Representative Boyer?
Yes.
Representative Boyer, yes. Representative Shamino?
Yes.
Representative Shamino, yes. Representative Clucci?
Yes.
Representative Clucci, yes. Representative Flynn?
Yes.
Representative Flynn, yes. Representative Foley?
Yes.
Representative Foley, yes. Representative Mastracchio?
Yes.
Representative Mastracchio, yes. Representative Morris?
Yes.
Representative Morris, yes. Representative Olson?
Yes.
Representative Olson, yes. 10 members of the committee having voted in the affirmative and 0 in the negative.
10 members of the committee having voted in the affirmative and 0 in the negative. It is the vote of the Joint Standing Committee of Health Coverage, Insurance, and Financial Services that the nomination of Mr. Matthew Colpitts of Winthrop for reappointment of the Maine Retirement Savings Board be confirmed. Congratulations.
Thank you so much.
I hope it cools down for you.
It will in about a second after I step out of this box.
Thanks so much.
Thank
Take
you all.
care. All righty. So we did have a presentation at 1:30. Maybe we take a 5-minute break unless.
See our folks here.
Ah.
We must have to. Hopefully they're on the hall.
Okay. We'll take just a slight break and then we'll go into our presentation. Great. Welcome.
This, I think, then also hold the LV folder for 961, so if you needed to refer to that.
Oh, great. Thank you.
Also see that on your desk if you. One is there.
Great. Thank you.
All aboard.
We seem to be dwindling in our committee members. Hmm. Go right ahead. Yeah, we had quorum to start, so we're good. Thank you. Yes, thank you.
Great. Senator Bailey, Representative Matheson, and members of the committee. The State Board of Nursing respectfully submitted this report as directed by the committee last week, pursuant to the passage of LD 961 as amended into law on February 17th of this year. The original bill sought to eliminate the 24-month supervision requirement. Yeah, it's only right. The 24-month supervision requirement for certified nurse practitioners. As you are aware, the law, which is based upon an amendment to the original bill, does not eliminate the period of supervision entirely. And directed the board to submit proposed practice standards for certified nurse practitioners to the committee for review relating to several items which are outlined on page 2 of the amended law. And at the back, you should have on the back. And I also highlighted the term supervising nurse practitioner, serving in a mentorship role. So it's the length of time a certified nurse practitioner must practice as a advanced practice registered nurse. Based on experience and licensing status, the minimum amount of time a certified nurse practitioner must practice with a supervising nurse practitioner serving in a mentorship role. The practice setting was also one of the items that we were to address in the practice standards, and any other factors as determined by the board. So the proposed practice standards for CNPs, in response to the amendment and prior to the law's enactment, the board designed a subcommittee which evaluated the issue and developed practice standards for inclusion into the existing Board of Nursing Chapter 8 rule regarding advanced practice registered nurses. So the board doesn't believe it's necessary to create a new rule since we already have the current supervision language in the Chapter 8 rule. So the subcommittee, as well as the full board, recommend the following practice standards to be established by rule for CNPs to address each of the issues identified by the committee. So the length of time, a newly graduated nurse practitioner applicant must practice within their applicable scope of practice in a clinical setting for a minimum of 1 year under supervising nurse practitioner serving in a mentorship role. The board determined the 1 year was appropriate based on review of multiple studies that do not show a correlation between the quality of patient care and lack of transition to practice period for nurse practitioner graduates. The recognition that certified nurse practitioners complete formal education that includes both didactic and clinical rotations with specific populations within their specialty training. That's their practice category. The determination by the committee and other stakeholders that a transition to practice period would contribute to patient safety and public confidence in the care being provided. The fact that the vast majority of advanced practice nurse practitioners located and working within Maine are employed at major health facilities with system safety nets and require collaborative agreements by the employer as a condition of employment. Decreasing the period of required supervision would increase access to care by lowering a barrier to entry to independent practice for recent nurse practitioners. and graduates, as well as lessening the burden upon supervising nurse practitioners serving as mentors. The second item was based on experience and licensing status. The minimum amount of time a CNP must practice with a supervising nurse practitioner as a mentor. So this is mainly out-of-state nurse practitioners with less than 1 year of experience must practice under a supervising nurse practitioner serving in a mentorship role until the accumulation of 1 year of clinical practice. And then the practice setting, a nurse practitioner who qualifies as an advanced practice registered nurse with less than 1 year of clinical practice, who enters into a required collaborative agreement as part of employment with a licensed physician or supervising nurse practitioner serving in a mentorship role may be approved as an acceptable replacement of registration with just a supervising nurse practitioner. The board felt like a CNP should not be limited in their employment options if there's not a supervising nurse practitioner mentor available, but there is a physician. So that would be an exception that the board, under its sole discretion, would make. And it would be at the discretion of the nurse practitioner to request that and show proof of that collaborative agreement. Other factors determined necessary by the board. The nurse practitioner applicant identifying a supervisory relationship with the supervising nurse practitioner must be, it has to be practicing in the same practice category. This ensures that the supervising nurse practitioner mentor is competent to review the patient care rendered by the nurse practitioner applicant. Documentation requirements, the applicant's documentation of the supervisory mentor relationship must reflect that the applicant will be working within his or her scope of practice, which is defined by educational preparation, certification in a specific role, and population foci and the type of licensure. The applicant identifying a supervising nurse practitioner mentor relationship will complete an online registration of a supervising nurse practitioner serving as a mentor as part of the initial authority to practice. They'll submit an application and fee, and the nurse practitioner must submit to the board written evidence of completion of the required mentorship. The minimum criteria to serve as a supervising nurse practitioner mentor, this has not changed. It's currently in law. So the requirements for that are the same. And then to assist the committee, there's a few appendices. The first one is a summary of the meetings of the Board of Nursing Subcommittee and then the full board. Then Appendix D is a summary of the proposed additions and changes to Chapter 8. I'm happy to go through those and reference those with the Appendix C, which is the rule.
Thank you.
Draft rule. So under the definition section, which is in section 1, page 3 of the rule, you'll see a new definition for practice category, and you'll see the definition for supervising nurse practitioner, which is the same exact language as in the law. And then the new requirements for initial approval, this is section 2, page 7. And I apologize, it's so small. It's the only way I can print it when it's track changed like that.
No problem.
So unencumbered and active RN license. The applicant submits evidence of an active unencumbered RN license, which must remain active throughout licensure. We have a section in here on Canadian graduates, and that was just for clarification that they have to demonstrate proof of national certification by an appropriate national accredited body. And then the mentorship by a nurse practitioner as a clinical supervisor, that's section 2, page 7 and 8. It just outlines what I mentioned earlier, the minimum 1 year, the exception to the mentorship by the nurse practitioner at the request of the CNP applicant, and then temporary approval to practice pending certification. That was already in the rule. We just pulled it out because it was confusing. The section, we just pulled it out as a separate section. And clarified that the supervising nurse practitioner is required for a CNP applicant pending certification. Happy to take your questions.
Thank you for your presentation. Other questions from committee members? Representative Clucci.
Thank you, Madam Chair. And I missed the beginning when we came in. And can you just remind me, this is for nurse practitioners to be able to open their own practices?
This is for nurse practitioner graduating, new graduate.
Right.
It doesn't matter where they're going to work.
I see. Okay. Okay, thank you.
Yep, Representative.
Thank you, ma'am. Thank you very much. Why just Canadian? Why not others?
That's a good question. And Amanda, you wanna?
Thank you.
Yes.
Other foreign licenses, I would probably ask, would be the question.
Yeah, there's not a lot of foreign nurse practitioner programs. Do you want to?
Sure.
Sure.
So I think part of it is absolutely that it's around the education that we will accept as meeting the same requirements as what is expected of US graduates. Part of our requirement for those graduated outside of the US or Canada is that we go through True Merit or CGFNS, which is a system that looks at the type of education and if it meets the standards. And so
It compares to ours?
yes,
Okay.
exactly. And so Canadian is not part of that, and that's why it's listed separately, because it's not considered to meet the requirements for outside of the United States.
Thank you.
Thank you.
Representative Arford.
Thank you. Can you hear me?
Yes, thank you.
First time in 6 years is the first time I've done this. So thank you for calling on me. And because I do not have the papers in front of me, I just want to make sure what I'm hearing is the biggest change really is that you're moving from 24 months or 24 months to 12 months of supervisory practice. Is that basically correct?
That's correct.
And my question for you around, if I was here, it's kind of weird to ask this over Zoom, but we hear a great deal in this committee about the different professions and what their requirements are, et cetera, et cetera. And oftentimes it's presented to us in a comparative format, like this group does that, this group does that. So it's my understanding that the physician associates will continue with their 4,000 hours, which is basically 2 years of collaborative practice. And so my question is, what at this point how did the board determine that at this point you would reduce those hours where what is presented to us as a comparable healthcare profession would not be doing that? They would still have the 2-year requirement. So I'm just wondering how you could just explain your thinking around that.
Sure. I think I listed several reasons the board determined 1 year. Did you?
Yeah, so, and did you get the information that was handed out to us, Representative Arford, about with on page 2, the Board of Nursing determined that the 1 year period was appropriate based on about 5 different reasons. Did you get that information?
I have not received anything electronically, but if that's where the answer lies, I certainly will take a look at that when I am back at my work show and able to do that.
Great, thank you. Additional questions? Oh, okay, yeah, so Colleen said that she did email that to you, Representative Arford, so you should be in your email for you to take a look at. Additional questions? Seeing none, thank you very much for your
Thank you.
presentation and your time. Thank you for
Thank you.
putting that work together. Appreciate it. All right. We'll move on to language review.
We have to take action on this.
We don't, I mean, we can, we. Yeah. Because if you. Great, thank you. Great. Yes, let's go in order. Thank you.
Okay, so there were a number of language reviews for you today. On yellow are the ones that the committee this will be the first time the committee has seen them. Some of them are based on language that you saw when you had the vote at the work session, but a few of these have had some additional changes made based on the committee's motion. So I'll try to walk you through those as you go through. The ones that are on salmon color are ones you have seen before, but the fiscal information has been completed. So those are ready to be reported out if they are and waiting for the committee's final approval. And then I think on white, you have a revised letter to Commissioner Cohen related to the committee's consideration of LD 2088. So if you're ready to jump into it, we can go one by one.
Thank you.
Okay. So the first one is LD 1220. This was an act to allow chiropractors to treat dogs and equids. The committee saw most of this language when you took the vote on this last week, but made some additional changes that I'll highlight for you as we walk through the yellow piece of paper. So the first change is at the bottom of page 1 in subsection 2, adding language in that first sentence that provides authority to the Board of Chiropractic Licensure to collect a fee from someone who's applying for the additional authority to provide animal chiropractic care. So that first sentence has been modified to say chiropractor license under this chapter may submit an application together with the fee as set under section 558. And that's the existing authority for the board to adopt fees. So that's the first change I'd call your attention to. The second change based on the committee's discussion would be within subsection 3, subparagraphs 1 and 2. I've modified the language in subparagraph 1, hopefully to make it more clear that licensees may perform animal chiropractic care on animals only to the types of animals on which they've received training. And as long as the licensee, and there's sort of an either or set up in the statute, as you'll remember from your discussion last week, in the first instance, if they have obtained a referral from a licensed veterinarian to perform animal chiropractic care on the animal. And then the second option would be they've requested and received medical clearance from a licensed veterinarian. So the time frame has been reduced to 48 hours in that second sentence. A licensed veterinarian must respond to a request from a licensee under this paragraph within 48 hours of receiving the request. We've retained language about the licensee, the chiropractor, being responsible for ensuring accurate and complete records. But then in place of some of the language that was in your earlier version, you wanted to include a directive to the Board of Chiropractic Licensure and the State Board of Veterinary Medicine to jointly adopt rules to implement the process for medical clearance. So that's those last couple of sentences there in subparagraph 2. And the rules, at least, would be routine technical. So that's one thing, I guess, if the committee wanted to change that designation from routine technical to major substantive, you could do so. The other change, I guess, that I would call to the committee's attention, the rest of the language was reflected in the pink, version of the amendment that the committee looked at earlier. I would note that I added a new section just to make it absolutely clear. If you look at section 3, which is at the top of page 4, amended the licensing chapter for the State Board of Veterinary Medicine to put in their licensing chapter a directive to that board that they shall jointly adopt rules with the Board of Chiropractic Licensure to implement that process for obtaining a medical clearance, just to make it clear that it's a responsibility of both boards to jointly adopt those rules. So those are the sort of substantive changes that I think the committee had verbally, amended the prior version. So that's LD 1220. It is a divided report, so you'll see the vote sheet on the last page.
Sure, absolutely. Representative Clucci.
Thank you, Madam Chair. And I know I'm not on this report, so stop me if it's inappropriate for me to ask, but I was just curious, Colleen, on page 2, under that like there's this section 3, 2, and it says a licensed veterinarian must respond to a request from a licensee under this paragraph within 48 hours. And then there's the board, there's rules that are going to be written. If the committee, or sorry, if the boards are trying to develop rules and they want to sort of caveat, like, well, if this, then that, sort of in terms of responding within that 48-hour, is that word must going to tie their hands to make it so that they can't create sort of,
if you're asking about like if they would have an opportunity to request additional information in the meantime, or something that would
yeah, or like what if
it would allow that? Yeah.
I mean, I'm just wondering, like, what if like there's like a small vet that's like never even heard of this, right? And they got the phone call, and like they're on vacation and they like must respond. I mean, that word must, I'm just wondering if when you're writing rules to make the rules sort of reasonable for for implementation, I just wonder if that word ties hands.
It shouldn't.
Okay.
It allows the response to be done in accordance with the rules that are going to be adopted. So, and it just says respond. It doesn't say they have to grant it. It doesn't say they have to, say yes or no. It just says respond to the request. So the rules could contemplate the ability of a veterinarian to request more information and for then that to extend the time, for instance, which is some of what the committee had talked about. So I do think it provides the flexibility for the rules to accommodate kind of the potential for any exceptions. I guess if the committee was concerned about that, as I said, the rules right now are routine technical, although those are adopted with pursuant to the APA, and there's a public process, public hearing, public comment. If the committee wanted to have, you know, additional review of the rules, you could designate those as major substantive. But
Additional questions? No? Sure, absolutely. All right. Looks good.
The next is LD 2056. This was the legislation that made a change to the Consumer Credit Code to accommodate those automobile loans that would allow a differentiation from the requirement that loan payments must be substantially similar. So this is just the revisor's office version of the markup that I had showed the committee earlier, making those changes. Reducing the maximum percentage from 50% to 36%, and then you'll see no fiscal impact required. So that's LD 2056.
It's good.
The next one is LD 2082. This is really a cleaned up version again of an amendment that the committee had before you on goldenrod and pink at the last work session. So it incorporates some of the changes that the committee made. And I'll sort of highlight those changes as we go through. This is the bill that addresses the use of artificial intelligence in therapy or psychotherapy. The first section, section 1, is a general prohibition on persons from providing, advertising, or otherwise offering therapy or psychotherapy services, including through the use of internet-based artificial intelligence to the public, unless the therapy or psychotherapy services are provided by a licensed professional. So right above that, at the top of page 2, the committee voted to include a change in the definition of therapy or psychotherapy services to narrow the scope to define it as services provided to diagnose, treat, or address an individual's mental health or behavioral health through therapeutic communication. The original bill spoke about or referred to diagnose, treat, or improve an individual's mental health or behavioral health, but changed that to address, because if you look at the definition of therapeutic communication, which is also defined, the phrasing there is intended to diagnose, treat, or address. And in order to make those consistent, I did that. So the phrasing in both paragraph C and paragraph D have been changed to be consistent with one another. Sections 2 through 8, I believe. Yeah, sections 2 through 8 are the same. They make the same changes in each of the licensing chapters that govern the licensed professionals that have within their scope of practice the ability to provide therapy or psychotherapy services. So that would include some advanced practice registered nurses, osteopathic physicians, allopathic physicians, and physician associates. It also would include licensed counseling professionals, and marriage and family therapists, licensed social workers. So all of the changes are made to each of those licensing chapters. And I'll go through the run through using section 2 as the example of where the committee has made changes from prior versions of the amendments that you've seen. The first is to remove any ability for consent to be provided orally. So in paragraph C, the sponsor had previously suggested adding the authority to provide oral consent. So that's been removed in paragraph C. So consent must be in writing. You also had wanted to indicate in that paragraph C or authorize someone to initialize a specific section of a larger general consent to treatment document. So if you look at the third to last line, there's language added or provided by initializing a specific section of an individual's general consent to treat agreement to include that authority. So that's been included. Excuse me. There's been some sort of technical changes just to in all of the sections where the subsection 2 starts out, a person licensed or privileged to practice under this chapter, or a person licensed under this chapter, because that was repeated a number of times throughout all of the subsections, just for ease of drafting. I added in all the sections referred to in this section as the licensee, so then we could just say licensee instead of person licensed under this chapter and repeat it all the way through. So that change has been made in all of the sections. Subsection 5 has been added, and that subsection provides that licensees may not deny or refuse to provide therapy or psychotherapy services to a client on the sole basis that the client has not provided consent to the use of artificial intelligence to assist in providing supplementary support in therapy or psychotherapy services. So that was something that the committee directed through an oral in the ought to pass motion. So that's been added to each of the sections. Also added language in subsection 10, specifying that the rules are major substantive. Subsection 11 has been added, which would prohibit a waiver by a client of the provisions of this subsection, stating that those would be contrary to public policy and void and unenforceable. And then subsection 12 has been added in all of the sections, just adding language recognizing that this section may not be construed to prohibit a client or a client's authorized representative from maintaining an action for harm caused to a client attributable to the use of artificial intelligence, maintaining an action alleging professional negligence by a licensee, or seeking other remedies available under other provisions of law. So I think that captures all of the changes that the committee wanted on 2082.
Questions? No? Good, looks good, thank you.
Okay. The next one is LD 2088. The committee had seen this minority amendment previously. The majority report is ought to pass. The minority report, which you'll see here, is on the salmon. You had not yet seen the fiscal information, which is the second page, which shows that any minor cost to the Office of Professional and Occupational Regulation associated with reviewing and maintaining the documentation can be absorbed within their existing budgeted resources.
Okay.
So I think actually that should, I'll have them change that. It should probably say the board of the licensing board
Licensing
specifically,
board,
not
yeah.
OPOR, but
Yeah.
the intent is that minor other special revenue costs. So if it does go forward, would not go to the special appropriations table, as I understand it.
Representative Bucci.
Sorry, and so, so this is just to confirm, so they're submitting documentation, but it doesn't require the board to like sort of quote unquote, like approve, correct?
This does, because it's, if you, but we could certainly change that. If you look at line 26, physician associate shall submit documentation required by the subsection to the board for approval, and the documentation must be kept on file. I think that's I think that's intended to make sure that they're getting the documentation that's required.
But they wouldn't necessarily have to write back and say, okay, I approve this, like you may go forth.
No, I think that what they would determine is that they've received the documentation that they're supposed to file, and as long as they receive that, then
Great.
that would be it. Yeah, I
Yeah.
don't think it's, you can't go out and practice unless we approve it. It
Right,
more
'cause it-
meant that the documentation is satisfactory to the board, but
Yep.
if
No,
it
that's-
could be amended slightly if you wanted to sort of say that. So documentation required by this subsection to the satisfaction of the board in place of that for approval language. If you are concerned about that,
Oh,
you know what I mean?
I think, yeah, I would actually like to
Yep.
change that if
Sure.
that's okay.
Yep.
I see Rep. Arford has her hand up, so.
Yeah.
Representative Arford. You
can
are
do
on
that.
mute.
Yeah, I just want to quickly make sure that there isn't a copy of this in my inbox somewhere and I'm not finding it. I don't know if these were sent out to us electronically. I don't think they were, correct?
No,
No, they haven't.
I haven't had a chance yet, but I will.
No,
I will do that.
I'm just wanting to make sure I'm not making a mistake. So considering that, Colleen, could you just read, and I really apologize for asking you to do this, but just one more time, what the approval, the notification wording is? If you could just read that one more time, I'd greatly appreciate it.
Sure. So this amendment would amend the current law to require that those physician associates who have more than 4,000 hours of clinical practice and are the principal clinical provider in a practice must submit documentation to the board that describes the physician associate's scope of practice as determined by the independent practice setting, including information about the location of the physician associate's independent practice, how the associate PA will consult with or collaborate with an appropriate physician or other healthcare professional as indicated by a patient's condition, or refer a patient to a physician or other healthcare professional, which is a reflection and a restatement of the current law. And then it would also amend the language to require a PA to submit documentation required by this section, which I've just described, to the satisfaction of the board, as amended just now by Representative Clucci, and the documentation must be kept on file at the main location of the PA's practice and be made available to the board or the board's representative upon request. And it also would require that upon any change in the scope of practice, the PA would be required to submit revised documentation to the board.
Okay, so and I just want to also make sure I understand this, because when I saw the wording that was already in the statute that said a supervisory or collaborative arrangement or relation, whatever, however the wording is, needed to be in place, that's already in statute, correct? That's not.
That's correct.
So we're not touching that. This, because I wanted to make it clear that my support for this, and I believe that Representative Clucci, when I spoke with her, we agreed that we are doing away with the practice agreement. There's no practice agreement required. This is a notification to the board, providing board with the information so that they will know what the physician associate is, where they're practicing, what
Right.
their over practice is. That's all it does. That's as far as it goes.
Yep. It requires them to say where they're practicing, what their scope of practice is, and how they will collaborate or consult with a physician if necessary, which is restating a provision that's already in statute.
Right. And
Those things.
great, super. And so regardless of what we do with this amendment, they'd still be required to do that, correct?
Correct. Yes.
Representative Boyer?
Thank you, Madam Chair. So Colleen, you're going to make that change, and then is that going to come back to us again for language review?
Can we do that?
Okay, can you just remind me how many times we've done a language review on this amendment?
This would be the second.
This is only the second.
Turn on the mic.
Thank you.
It's, yeah.
If, and we might be able to do this through
I was
email.
just gonna say,
I think we could probably do this.
I don't come back to everybody this
Yeah.
week. Yeah.
Great.
Because it's already the otherwise.
Great. Thank you very much.
White
Yes.
is the next one. So the committee as a whole, had decided to send a letter to the commissioner, asking the commissioner to coordinate with the OPOR licensing boards and the licensing boards affiliated with the department to determine what workforce information is currently available to the licensing boards about where licensed healthcare practitioners are practicing and how to collect some of that information. The committee had looked at a prior version of this letter. I've really just added an additional sentence at the bottom of the white second paragraph to specify kind of what the committee was looking for. We are interested in hearing about what workforce information may be collected through the licensing and renewal process, and what suggestions you have for collecting this information through the licensing boards, through MHDO, or through other mechanisms. And then they would be asked to report back to the committee with their recommendations and suggestions next session.
Great. Thank you. It's good. Any questions? Great.
Okay. This next one is community paramedicine. I don't think I actually made any changes to the language of this. The committee saw this amendment when you took the vote last week. It's just really kind of cleaned up and put in the format that is necessary for the fiscal office and the revisor's office to start processing this. But just to quickly remind you about what this does, this is a bill that would put in place some specific authorizing language for the EMS board to license community paramedicine clinicians, community paramedicine services. You'll see the changes here are highlighted in bold italic language, as was in the previous version. Added language defining EMS, required that initial rules be major substantive, subsequent rules would be routine technical. And then in section 10, which is in the middle of page 3, adding language recognizing that individuals can serve in both roles as primary care medical director and as emergency medical services director for community paramedicine service. And the board may not restrict eligibility to only licensed physicians and shall permit eligibility for individuals serving as a volunteer or, as I mentioned, serving in a dual capacity as both.
Great. Thank you. Looks good.
Next one is LD 2151. This had, the committee had seen the language of the majority report. When you took the vote, I corrected the name of Penobscot Community Health Center. Representative Arford had voted for a minority report to extend the time in which FQHC could submit a proposal for the funding, extending that 6 months. So you'll see in the language of the minority report, which starts on page 3, just changes the date from December 15th to May 15th, 2027. And I recognize, Representative Arford, that you don't have this in front of you, but I will email it to you. So if it doesn't conform to what you are interested in, we can make changes.
Great. Looks good.
The next one is LD 2189. This was the bill related to notice of termination or change in maternity care services. You're just reallocating it to a different section in statute. You had seen this language, but no fiscal impact. So this one is ready to go. It is a divided report, so you'll see the voting sheet on the back.
Great. Looks good. Thank you.
Okay. Want to keep going in order? Or you want to skip over?
We'll skip over that.
Skip over. Okay.
Yeah.
We'll go to 2209 next, which is one of the bills that came out of the commission to expand access to oral health by studying alternative pathways for obtaining a license to practice dentistry. This were a few changes that the committee made to the resolve as drafted. You'll see the new language in bold italics. One is to add to the sort of duties that the department would be asked to look at. They would be asked to explore options to expand education and training programs for dental therapists in the state. In addition to, in paragraph 2, they're asked to explore options to establish dental specialist residency programs in the state.
Great.
And then in section 2, there's been some changes to the stakeholders that are identified for participation. Striking out the Board of Dental Practice and replacing that with language in the last sentence that would direct the Office of Occupational and Professional Regulation, that's what that should say, to provide technical assistance to the department on behalf of the Board of Dental Practice, and then adding specific reference to representatives of the Maine Oral Health Centers Alliance and dentists working in private practice that serve the oral health care needs of underserved and high need populations. Otherwise, the language remains as drafted in the original bill.
Great, looks good. Okay. 209.
And then finally, the last one is LD 2201. I'll sort of highlight for you and go through the where the changes are based on the committee's vote. I know the committee has continued to get additional communication from folks about proposing additional changes, but I'll go through and highlight for you the changes that reflect the committee's motion. And I think the easiest, and for this one, I did sort of highlight for you the bold and italicized language here. So I'll just focus on where the changes are made. And then if anybody has any questions, we can go back and talk about sort of the overall bill. We can go back and talk about it. But the first change is in the definition of management services organization. The committee, the committee's motion asks that definition be clarified to provide that MSO means any organization or entity owned or controlled by a private equity company or hedge fund that contracts with a healthcare provider or provider organization to perform management or administrative services relating to supporting or facilitating the provision of healthcare services when the healthcare provider or provider organization is also owned or controlled by the same entity, private equity company or hedge fund. So that's the first change. The second change is reflected in paragraph C on the middle of page 3 and also on page 6 in paragraph D. But it clarifies and provides some more specificity about the confidentiality of certain information that might be provided as part of this process. The language of the original bill provides that the default is that information provided by submitters as part of the process is public. Unless the submitter, and this is clarifying language, requests that the information be designated as confidential and the department determines that it contains proprietary information. Under the bill as proposed, it stated unless the submitter designates documents or information as confidential when submitting the notice and the department concurs with the designation in accordance with the process specified by rule. The Freedom of Information Act requires that exceptions from public records are designated as confidential in statute. So allowing that to be determined by rule is a little bit outside of the process for designating the information as confidential. So I think you need to sort of provide the legal authority for the exception right in the statute. And so the suggestion is that the submitter can request that the information be designated as confidential and the department determines that it contains proprietary information. And there is a definition of proprietary information that is used in other sections of statute that reflect a similar process where when somebody submits information to an agency, they can flag it for the agency as proprietary. And then the department, if ever asked to share that information pursuant to a FOA request, can make a determination about whether it fits that definition of being proprietary. So proprietary information is defined as a trade secret or a production, commercial, or financial information, the disclosure of which would impair the competitive position of the healthcare entity or would make available information not otherwise publicly available. So that's the
Orient to me to where you define that.
paragraph C in page 3.
Okay,
So
great,
the
got it.
top says
Thank you.
information is public unless the submitter requests that the information be designated as confidential because they believe it's proprietary. And then it
great.
defines what proprietary information is.
Yep. Representative Olson.
Do we need language in there that if the board determines that it's, in their opinion, it's not, that they advise the person that supplied it, that they're supplying that information? Because in other words, they can just supply it in the blind and the originator of the documents would have no knowledge that
Yeah,
that's been supplied.
yeah, there are other provisions in law that allow that, and we could certainly do that. Typically, it would be in most cases, it's known right up front what's confidential and what's not, based on the determination of proprietary. But if there is any opportunity for a notice, I
Yeah,
think the
because I'm
committee
just,
could do that.
we're giving that decision-making authority to the board. So they could override, someone could submit something believing that it's proprietary. And the board can override that. If they don't know if they've overridden it, they're going along feeling that it's not being disclosed, but now it is disclosed.
Typically, yeah, and typically that's how it happens. There is a notice provided, there's an opportunity to challenge it under FOA. There's a legal process for whether or not information is released, so we could cross-reference that and provide that information if the committee feels that that's necessary. I did want to point out that there are specific exceptions here that do allow the disclosure of confidential information, which haven't been changed. I haven't proposed to changing those, but it allows the department to share information with the Office of Affordable Healthcare, which is going to be a partner agency in conducting these reviews. It allows confidential information that would be proprietary to be shared with consent of the party. That's what you were just talking about. And it also allows the sharing of information if there are any contracts with consultants or experts as part of the material change transaction review process. As long as the contractor agrees to maintain the confidentiality of the information. So that's sort of reflected in both paragraph C and paragraph D. And reflects those exceptions. Because, and we've talked about this before, because they are exceptions, Judiciary Committee will have to undergo the review that they do, kind of looking at that. But that's the second substantive change I wanted to point out. Okay. I will make a note about the notice. The next one is in page 4. Added a new paragraph D at the bottom of subsection 2. And this is just recognizing that the review of a proposed material change transaction under this section is concurrent with any review pursuant to chapter 103A. That's the certificate of deed law. Just sort of clarifying that's not one or the other. It might be both parallel. And then on page 5, you'll see in subparagraph 7 in the middle of the page, and then a new subparagraph 9 in the bold italicized language, adding that as part of the criteria that is looked at during the review process is including the impact of a sale and leaseback arrangement if the main campus of the healthcare entity is leased from a real estate investment trust. And subparagraph 9, including consideration of the debt to equity ratio of the healthcare entity following the transaction. And that's sort of pulling in the substantive kind of provisions from those other two bills, 2197 and 2198, into the review process. I mentioned the changes already to paragraph D. That's just related to proprietary information. It protects as confidential proprietary information, except that the department and the office may disclose confidential information with consent or to experts, as long as the expert or consultant maintains the confidentiality of the information. The next changes are.
Sorry.
Oh, sorry.
Sorry, Senator Bailey.
I'm not looking up.
Sorry. I wasn't looking up either, clearly.
I know, everyone wants out the window, but just.
No, I was reading.
Didn't know if you were noticing the typo on
Yes.
D1 party,
Yes, yes.
not part, okay.
Yes.
Okay.
You sorry. Gloss over those and I'll fix them, but yes.
Sorry.
That's okay. I appreciate it. I'm glad somebody's looking at it with an eagle
Oh.
eye.
Part from.
If you look at page 9, I believe the committee also wanted to change the designation of the rules from routine technical to major substantive. So that's there. And in section 2, this is the provision that relates or requires healthcare entities to provide notice and report certain information to MHDO. The first change is the bottom of page 9. I believe the committee's motion was to change the reporting from annually and upon any changes to once. One time. I stuck a date in there, no later than July 1, 2027. and subsequently upon the completion of a material change transaction that would happen after that. And then I believe you also wanted to increase the exception from 5 to 6 to be consistent with the other provision for independent provider practices. That's in subsection 3 in the middle of page 11. And then because the reporting, the one-time reporting is July 1, 2027, I sort of shifted by 6 months the sort of posting requirement for MHDO to post aggregate information that's been received from July 1, 2028 to January 1 of 2029. So, and then the other thing to keep in mind is the whole bill, the whole thing takes effect 1/1/27. So kind of had to shift some of the dates around to make that happen. So that's, I think, all the changes that the committee had voted on, but as I mentioned, I know you continue to receive additional requests for changes. And the number of them have been distributed to you today. I'll stop there.
I had a question.
Representative Boyer.
Before we get into the changes, I thought one of the things we had also talked about, Colleen, was the exception from reporting for the 6 or less. I thought that was also, we also talked about putting that into the first section of the bill. And I don't remember where we talked about putting that in, but I thought we talked about also making that exception for the smaller practices.
Oh, okay. I did not remember that, so I apologize.
Well,
You could
maybe-
certainly do that if you wanted to.
Maybe I'm remembering wrong. I don't know if other committee members remember that.
You don't remember that?
You certainly could if you wanted to. And you could build it in a number of places. I guess if you wanted to talk about it. There are some, when you go back and talk about it, I guess the review process sets up sort of the opportunity for preliminary review that can be just determined fairly quickly, and then other transactions would be shifted to sort of the more comprehensive review. So you could think about where that would be. I mean, you could do it, you could either provide an exemption, or you could do it through the definitions if you wanted to exempt out certain provider practices or smaller practices. But I apologize if that was something that was part of the committee's vote. I did not remember that.
Sounds like it was only me, so I think you're good.
Discussion? Representative Clucci?
Thank you, Madam Chair. I happened to miss the first work session on this because I was in my other committee. And there's a lot of changes that we've gotten. Is it at all possible for us to take a beat on this and maybe give us a chance to come back on Thursday, so we can just reread everything and then possibly either reconsider or just say we're good to go on Thursday? Because I just feel like there's a lot of information. I don't feel prepared to be able to say, yeah, good to go. So, okay.
Yes. Representative Foley?
Thank you, Madam Chair. One of the things that has come up, and I think it's appropriate, we haven't exempted dental practices, and dental practices by nature can't be owned by a private equity firm, or, I mean, it has to be owned by a dentist or dentist. So I'm not sure why we're capturing it in this, because this is really about controlling private equity from owning medical practices, but they can't own a dentist. They can't own a dentist practice. So I'm just wondering if it would make sense just to exempt, when we're talking about exempting, to exempt dental practices out of this requirement for reporting and all that.
Yeah. Representative Mastracchio?
Thank you, Madam Chair. I'm not sure that that's all completely true, because I'm looking at, we have Aspen Dental, and that is private equity. That is, would like to know exactly how it works. I think that a private practice, but clearly there's corporate dentistry in Maine.
But Aspen Dental, they don't own the practices. they're like a franchisee. A dentist actually owns the Aspen Dental practice.
Well,
They provide, Aspen provides backroom human services and billing and that sort of thing.
yeah, but if you actually look at it, it's a way around. I'm just saying that we need to, before you say that, I think there's a way around that they've gotten around it. I'm just looking at the information, and granted, it's AI. I mean, I just did it real quick because I know that I think it says they're all it may be independently owned, but it's the Aspen Group is the parent company. So I'm not so sure you
I mean, we
should
can look
exempt
into it
them.
further.
Yeah, I
mean,
think that you might want to
I
look
mean,
at it before we
and I-
put
and I
language
agree.
in here.
I'm happy to read this, look at it, talk about it and bring it back Thursday. So, so we can, I mean, I know of an individual is part of Aspen Dental, but owns it but they do his human resources, they do some of his billing, but they,
It's a workaround. Sorry, it is a workaround. So it's worth looking at though. Thank you.
anyways, I again, when the commission, when we dealt with this, we really were looking at trying to capture when private equity comes in and tries to take over. And so I think that, we need to, I just want to make sure we're capturing the right entity that we're going after. And also on this reporting issue, we're really having every medical practice report to MHDO. And I'm not sure that makes sense. If let's say if you're a private practice, physician's private practice with no private equity involved at this point in time or no material change, why do they need to report to MHDO at this point in time? Now, if private equity came in or they had a material change of some sort, then I could see that it would need to be reported. But it just seems to me that I don't want to have people reporting for the sake of reporting. So that just a comment.
Representative. Thank you. I think Representative Foley, what I would just say in response, and I'm open to making changes, for sure. Like the conversation you just had with Rep. Mastracchio, I think what we're finding as we delve into this is there's a lot more private equity actually taking place than we knew about. And I think that also there is the exemption in the reporting for less, 6 or less. And so I guess my thoughts, and again, I'm open to making some changes, but my thoughts on having people report one time is it would give us an idea of the landscape and what is out there and what is not. Those are just my sort of thoughts on it.
Representative Mastracchio.
Yeah, I just want to, it says Maine law does require that that they be owned by a licensed dentist, but each Aspen Dental office is technically owned by a dentist. So you can identify the owners, but while the local dentist owns the clinical practice, they sign agreements with the Aspen Group for management services, meaning the corporate entity dictates operational decisions, fees, and equipment. It's a workaround. So I think it does warrant more discussion because I think that's what happens. They say one thing, yes, it's technically true, but not in fact what we really think of as a dentist. It's kind of like, oh yeah, I'll give you my name. How much you're going to pay me? And I'll sign off that I'm the person that owns it or whatever.
Representative Olson.
But that sounds to me like a franchise agreement. And if it's franchise agreement, then it's picked up under the state franchise laws anyway.
It's not, it says specifically it is not. It is a corporate owned model that uses licensed dentists to meet state requirements in other states like ours as well as ours. It is not a franchise.
So is there anything procedurally we have to do? Just say that we're going to come back and do an additional language
Yeah,
review since?
yeah.
Yeah,
Yes,
okay.
Yeah,
That's what
I
I
don't think
figured.
you necessarily need to table it or anything,
Okay,
like take a
great.
vote if you decide to
Thanks.
revisit this again on another day.
Representative Flynn.
Thank you, Madam Chair. Pauline, in this case, in any of these cases, who are the stockholders of the corporation? Those would be the owners. Whether it's Aspen Dental sign out front or not, it does, who owns the corporation that is hanging the license? If it's private equity, it's private equity, but who are the recorded owners? And that should be a simple find. Excuse me, thank you.
Yeah, I think part of the information that's going to be required to be reported to MHDO is about those things, about the ownership structure of these entities. And so I do think that part of why the original bill required annual reporting, but you're moving it to one time, was trying to get a sense of kind of a baseline, if you will, and then a continued reporting upon these changes. One thing to keep in mind is that the scope of the legislation is that it would require notice when one of the entities subject to the scope of the bill, and you have to look at the definitions and how the terms are defined. But if a material change transaction was taking place, then the healthcare entity would be required to file notice with the department 180 days before at least, and provide information about the parties to the transaction, the agreements, and then the like. And then the department it would be required to post information that this has been received and then make a determination of two things. One, is it subject to preliminary review? Or two, is it subject to comprehensive review? And if you look at page 4, you'll see the sort of the standards that outline what things are preliminarily reviewed and which things are required to be have the lengthier and kind of more comprehensive review in terms of the criteria that are looked at. And it identifies in paragraph B there, like specific transactions that must go through the comprehensive review, like the really large ones, assets over 100 million. If there's a lessening of competition, if the department in their discretion determines that it's likely to have a material impact on cost, quality, or equity, or access to healthcare services. So those doesn't require sort of all of the transactions to go through that comprehensive review, but it has that. And then if you look at the definition of what a material change transaction is, this would be only these transactions would sort of trigger the requirement to provide notice. The acquisition of a majority interest or operational control of a healthcare entity within the state occurring during a single transaction or a series of related transactions by a private equity company, hedge fund, or management services organization. And you've further defined or further narrowed the management services definition. So I think you've reduced the transactions that are going to be required to be reviewed, at least so far, and you could continue to make additional changes, but yeah.
Additional questions or discussion? No, I think that was the last language review, right?
That's what I had for today, yeah. Great. So there'll be a few more maybe on Thursday.
Great. All right.
Thank you.
We are adjourned. Thank you so much.
Thank you.
We just need to make sure we sign those
Yes.
confirmation letters for the